Hello everyone. Today, let us see about one of the very important complications of long-standing diabetes, which is diabetic neuropathy. What is this diabetic neuropathy? This is nothing but the effect of long-standing uncontrolled blood sugar levels on the nerves of our body. More often, this affects the nerves of our hands and feet. What happens when the blood sugar levels are at higher levels for a long period of time? See, these complications don't occur overnight. They happen over a period of days, weeks, months, and years of exposure to high blood sugar levels. So, when the blood sugars remain uncontrolled or at higher levels for a long period of time, these tiny blood vessels which supply the nerves of our hands and feet get affected. This in turn leads to poor blood supply to the nerves of our hands and feet, and now they start giving you the symptoms. So, what do you feel? You start feeling burning sensation beneath the feet, sole of the feet mostly. Sometimes you will also experience pins and needles pricking type of sensation, or some patients even come with a complaint of pulling sensation at their feet. And these symptoms are more pronounced at night also. So, what should you do? Why are we concerned about this? One, yes, it is incapacitating. How comfortable are you when your feet are burning at night? Will you be able to have a sound sleep? No. It disturbs your sleep, number one. Number two, what happens when the nerves continue to get damaged? Eventually, what happens? The sensation gets affected. So, next, the patient will come telling us, I am not able to feel the surface where I am walking on. I don't know whether it is a smooth surface or a rough surface, whether there is water, will I slip or trip? I am not confident of walking. They will also say, I'm scared to go for my walks because whenever I walk, I'm not able to grip my slippers. The sandals kind of slip off my feet. So I'm scared I will trip and fall, doctor. That is why I don't go for my walks these days. So, another important complication of this is the patient is not able to identify the temperature. So he or she is not able to feel whether it is very hot or very cold. And we are very worried about the heat sensation because this can lead to blisters or burn type of injuries when the person walks bare feet on a hot surface. So what can you do for this? Managing your diabetic neuropathy starts with controlling your blood sugar levels. That is the first and foremost. It is not important to control, it is also important to maintain your blood sugar levels, as fluctuation in your blood sugar levels can bring back these symptoms. And to be very frank, when it is going to be a long term complication, you might not get 100% relief from these symptoms once the sugars are under control. There might be left a little bit of numbness and a burning or a pricking now and then. But what is most important is protecting your feet from injuries. Because, what did I mention earlier? The next will be the sensation which gets affected. And when the sensation gets affected, you are prone to injuries. This is why foot infections are more common in diabetic individuals, because they will not be able to feel a pin prick or a thorn prick, or even they would have walked on some broken glass pieces, but they would not be aware because the pain sensation is lost. So what should you do for this? Please examine your feet every day. I would say it is a must to examine it twice daily. Once in the morning after your bath and second at night before going to bed. Wash your feet, tap it dry. Please examine the upper surface of your feet and the lower, the sole of your feet and between your toes. What will you look for? Look for any injuries, any cuts, any thorn pricks, any broken glass pieces, any injuries. And between your toes, look for any presence of fungal infection. And if you find any infection or any cuts or injury, clean, wash, dry that area. Where if you have any antiseptic cream or ointment at home, apply it and do not delay. The very next day, please consult your treating physician. Please show your treating doctor any wound which you have got in your feet immediately. Do not delay. Don't wait for a day or two. Please go the same day, or if it is late, the very next day, and get it treated. In this way, you will prevent a prolonged foot infection, because long-term foot infections can start eating the bones. It can then spread up. A spreading infection can be more debilitating. It can even result in amputations and untoward complications in your life. Next, if there are any fungal infection between your toes, make sure you keep your interdigital space dry, and contact your physician so he or she will prescribe a good antifungal powder or a lotion for application. Please do not self-medicate or treat yourself when it comes to foot infections. The other important thing, the feet are prone for dryness, so make sure you moisturize your feet every day. Apply a simple coconut oil or any simple moisturizer cream which is easily available. The other very important thing is, I would advise you to refrain from any sort of hot water fermentation or a hot oil massage, or immersing your feet in lukewarm water, because you will not be able to feel the sensation. Even if you want to do something like that, make sure a person without diabetes or with normal sensation checks the temperature of the water which you are going to be using, because the commonest source of burn injury to the feet is immersion of the feet in hot water and hot water fermentation or hot oil massage. This is what we unfortunately commonly see in our day-to-day practice. So it is something that you can avoid easily. And the other most important is, please do not go out of your house barefooted. Please wear a good sandals. I would suggest a sandal type of footwear with a back strap, or a good comfortable walking shoes. Make sure you buy the shoes of correct size. Don't wear any tight fitting shoes. If you wear socks, preferable to use cotton socks, and please wash and change your socks every day. And also, when you're using the shoes, before wearing, please make sure there are no small stones or any foreign body inside your shoes. Before wearing, please dust your shoes well and then wear it. I always tell my patients, it is more important to take care of your feet than your face. It is okay even if you don't look into the mirror one day, but it is very important to examine your feet every day with a mirror. I would say, because more often as we grow older, or due to various reasons, we cannot bend and check the sole of our feet. So I would advise you keep a mirror below and check the sole of your feet. In this way, you will be preventing a very important, common, debilitating complication of long-term diabetes, which is foot infection. So thereby you prevent a number of episodes of hospitalization or amputation, so on and so forth. So I'm actually asking you to be selfish and take extra care of yourself and your parts. So please do it. Self-care is the most important, and this is the first step to make sure you lead a healthy, pain-free, and a safe life. to watch for more such interesting videos. Hope you liked it. Thank you.